Okay.
Mm-hmm.
Do we have audio? Okay, great. Okay, good morning. Welcome everybody to our weekly live Q&A. I'm sitting here with Dr. Rita Ellithorpe, our medical director here at Tesla Longevity Center. Things look different today a little bit. That's because our technology director, Blake, who's usually our cameraman, is not here today. So we switched things up just a little bit. So thanks for bearing with us. So for those of you who are regulars and watching, we welcome you back again. If anyone is here for the first time, there's a chat section over here on this side of the video where you can post your questions to us. You do need to be logged into YouTube for that. If you're not logged into YouTube or you can't get logged into YouTube, you can send your questions into office@tlcdoctors.com, and our staff prints those for us, and we ask those on the following week. So thanks for joining us. I'm going to be monitoring your questions as they come in here in the chat section. And I think...
And subscribe.
Yes, and please do us a favor. Like the video, subscribe, hit the little bell, and you'll be notified when new videos come out. We're on a mission here to get to 1,000 subscribers or so, which will unlock some tools for us, which will make this process more interactive and just better for everyone all around. So if you haven't already, please subscribe to the channel. Thank you so much. All right, I think, Doctor, why don't we go ahead and jump into a couple questions that we received over the week?
Okay.
Okay, first question here is from June. And June asks, I think I remember you recommending that we take a chelated zinc. Which of the following is a chelated zinc? Zinc acetate, zinc gluconate, zinc citrate.
Those are all chelated. The acetate is probably the least popular of them, but glycinate and citrate are all very good zinc chelates. Minerals are better absorbed through the gut when they're linked to an amino acid, and that's the chelate. That's what it means to say chelate, linked to something.
Right.
And the absorption is better. The company that has all the history and the reputable, good reputation for doing an excellent job in this is called Albion. And Albion is what we exclusively use for all of our zinc and other mineral supplementations. Are all chelated.
Right. We have a great one from Orthomolecular that uses the Albion chelate. I think it's called zinc or chelated zinc or something like that.
Right, yes.
And it has about 50 milligrams.
I think it's called reacted zinc.
That's
yeah.
it. So June, reacted zinc, if you're getting it from us, that is the one that uses the Albion chelated zinc, 50 milligrams, a very, very good dose of that. So a follow-up question to that, should zinc be taken on an empty stomach or can it be taken with food?
It can be taken with food.
Does it matter? Can you take it on an empty stomach?
Yeah, you can take it either way.
Okay. Can vitamin D be taken on an empty stomach, or does it require fat to be absorbed?
Well, vitamin D is a fat-soluble vitamin, and you could make the argument absorption would probably be better with a fatty meal.
Sure.
So I think ideally, but I've never taken my D. I take it the first thing in the morning on an empty stomach with my thyroid and my other enzymes. So I don't think it matters that much.
Right.
Okay.
The important thing is that you take it.
Yes.
And I've certainly found over time, for me speaking personally, and I think this probably holds true, the more you get used to taking vitamins and it becomes part of your routine, the more strong, I guess, your stomach is to taking vitamins. I used to, break my vitamins up throughout the day and try to take them with meals, unless they're specifically not to be taken with food, like a systemic enzyme. I would just take them with my meals. Now, because I know myself and I know if I don't take them all in the morning and I have my little baggie there, I'll forget. I just take them all at once on an empty stomach because I personally am doing intermittent fasting, which means I'm probably not eating until 1, 2, 3 o'clock in the afternoon. So I'm taking everything on an empty stomach, and my stomach can tolerate that. But that took some time to get used to.
The other thing is I have 32-ounce jar of water, and when I take all my vitamins, largely in the morning, I drink that whole 32 ounces. So it's another way that I'm pushing myself to get my water
intake.
And then during the day, while I'm here, these are 16-ounce glasses. I want to get another 2 of these in.
Yeah.
And then at night, I drink another 32
Right.
ounces. So if you add all that up, you know how much I weigh. That's half my weight in ounces. So.
All right, we don't need to do the math on that. I'm glad you brought up water because our next question that came in via email, again, office@tlcdoctors.com if you can't use the chat section, is about water. And the question is, I know we're not supposed to drink a lot of water before, during, or right after a meal, but I try to take my supplements with my meal, so I end up drinking a lot of water near a meal. What can be a solution for this? Thanks for your advice.
Honestly, I don't know that it's going to be that much of an issue. One is your blood type A. If you're a blood type A and you're taking a digestive enzyme with your meal, that's probably not going to have a problem, okay? The concern is that the water will dilute the acidity and enzymes concentration for the pre-phase of digestion, which is the mental salivation and getting ready to produce enzymes to receive the food with your meal.
Right.
And this is the concern. This largely is theory. I have over 40 years almost now not seen this really be an issue. The A-type blood people are always taking the orthodigestzyme. And then anyone who's roughly over 55, 60 years old, like myself, I'm not an A-type blood.
Right.
But now every time I eat, I take orthodigestzyme. I take it after I'm done with my meal. And then it turns the issue of concern about water and dilution into a moot point and is not worth worrying about.
Right. I've heard over the years here at the clinic a lot of comments about vitamins and taking them and difficulty swallow them. And got to remember, and you bring this up a lot, vitamins, most of them are basically derived from food. It's supplementing what our diet doesn't provide to us.
Right.
So if you can swallow a bite of food, you should be able to swallow, a pill or a tablet, and you just need enough water to really lubricate it. So I put my vitamins in my mouth. I take a mouthful of water. I kind of stir them around in my mouth, and then I swallow them. So I'm just drinking enough water when I'm taking my vitamins if I'm eating to get the vitamins down, and then maybe I'll chase it with a bite of food too.
The other thing is I do the same thing when I take my vitamins. I'll swish them around in my mouth, and that allows my saliva to mix in with the water, which makes them more slippery for swallowing, and that's one of the functions of saliva.
Good tip. Okay, our last question that came in via email this week was from, it looks like Christina, and she asked, hello, I was wondering if Dr. Ellithorpe could talk about how to manage Lyme disease. A relative of mine has been dealing with it for 4 years now. What would you recommend? Thank you, Christina.
Lyme disease refers to the tick-borne infection of Bordetella. These pathogens are carried in a tick, and then that's injected into you when they bite you. These are typically in the hiker mountain, the Northeast, and some in this Colorado mountain range here. But it can be elsewhere, and it usually has a target. It looks like a literal bullseye kind of a lesion. It doesn't have to have that, but it can. And so if you have any kind of a bite, or you've been out hiking and you start feeling flu-like symptoms and you had a rash, you should see your local physician who can look at that rash, make a determination, do some blood studies that look for antibodies to the Lyme pathogens. These don't necessarily seal the deal as far as confirming that you have it. And very often, if you get onto an antibiotic, usually it's in the tetracycline family, like doxycycline, and you get on that quickly within a week or two, a couple of weeks from the original incident, this tends to take care of it. But if it's missed, and you then go into the syndrome of the fatigue and the chronic achiness and stuff, it gets more difficult to treat it with the antibiotics. This is, standard of care. You need to see your local doctor. You need to possibly get an infectious disease specialist, because there are serum antibody titers to this, but this can fade as well and not be as reliable. There are other tests like the PCR, polymerase chain reaction testing that can be done for the Lymes, and there's several varieties of them. And so this needs to be handled aggressively by your local doctor and or an infectious disease specialist. The sooner you see it, probably the better the outcome will be.
Right.
Now, the healthier you are at the onset, the easier will it be for you to throw something like this off. So prevention and being in good health helps us with any situation, be it Lyme's or the flu, COVID, anything. And so if someone is taking vitamin D every day, that is going to decrease the virulence or aggressiveness of, for instance, Lyme's. If they are drinking enough water, if they are taking enzymes, systemic anti-inflammatory enzymes, if they are taking a good multivitamin or immune boosting, which we use here as the Juice Plus series, with many multiple studies to show the improvement in the immune parameters, white blood cell count, the T cell and lymphocyte counts, and so forth. So those people who are out there taking D, taking a multivitamin, taking Juice Plus, taking extra vitamin C, not eating a high sticky sugar, carbohydrate, immune suppressing diet, not eating late at night because that will suppress your immune system,
right.
Drinking enough water, and then you could find a doctor like us. Here we do the high dose intravenous vitamin C. We also have the ozone irradiation of the blood. These are ultraviolet as well as the oxidative stress of ozone that's infused into the blood to try and kill off these pathogens. And all this works to build your own immune system to throw things like this off. But I wouldn't discount doxycycline or tetracycline or some of these antibiotics. I have found over the many decades that this seems to be reasonable. But then, of course, you need to be on a probiotic, which is also an immune boosting thing. So a lifestyle, get your water, get your sleep, get your exercise, be low carb, don't eat late. We're all low in vitamin D. Take supplemental vitamin D, get the level checked, try and get it into the 60, 80 range, you know. And then take some immune enhancing supplementation like a Juice Plus, a multivitamin. I take iodine. Most Americans are deficient in iodine. That is helpful in as a antibacterial. Find a local doctor who does high dose vitamin C, ozonation, ultraviolet light irradiation of the blood, and just see how that all goes.
Okay. Well, Christina, that was a lot of information. Lyme's disease is a very complex disease ailment to deal with. Dr. Elthorpe mentioned quite a few different things that you could suggest to your friend. So hopefully you find some of that useful. Get your friend in to see a integrative physician and get the primary care team involved, get the infectious disease specialist involved, and we certainly recommend both as prevention and as supporting immune system somebody who's going through Lyme's disease. There's many tools in our toolbox that we can use to support that. Mm-hmm. Okay, now on to some questions that we've gotten from the chat today. First question is, I'm new to this and learning more about natural birth. What is your opinion on the heel prick test and vitamin K taken by mouth, not injection?
Well, there needs to be studies on this. I am not a pediatrician or a neonatologist. If the baby and the mother and the family are a healthy group, mom and baby and family situation, and mother's eating a good diet, she confers to her infant, as women have throughout all the thousands of years, a good immune system. Doing the heel prick test for vitamin K and thyroid, primarily it's been the thyroid, has been an invention since roughly the 1950s. For about 50, 60 years, we've been doing this. I don't think that there's any studies on the oral supplementation of infants, newborns, neonatologists units might have something on this. I haven't looked at that recently. But vitamin K comes as K1 and vitamin K2. And vitamin K2 is the one that's associated with the vitamin D absorption and bone health and the like, whereas vitamin K1 is associated with blood clotting and things like this. So I think the neonatology unit is more interested in vitamin K1, okay, as opposed to K2. And my thought would be, I think the testing for it is benign enough. I don't think there's anything wrong with the heel prick test for the TSH, the thyroid, and for the K1 levels. But I would have concern about administering injectable vaccinations. I would have questions that I would think needed to be asked about, do they really need them? And the parents need to get studied up on this and learn about clearly what is being offered or not offered. But regarding a heel prick for a vitamin K1 and a thyroid screen, I think is totally benign.
Sure. And if I could just take a moment and share my personal experience, because I just had a baby not too long ago, about 5 months ago. I don't know where in the world you are or where in the country, I would suggest from my experience, as well as one of our other physicians here, Dr. Kaur, who is another one of our integrative physicians, also had a baby. And she referred us to a local midwifery to see a nurse midwife that has doulas. And the name of the place that we went to is called South Coast Midwifery, and they are an integrative midwife facility. So much like we're integrative physicians here, meaning we practice standard of care, but we also have a toolbox with lots of other things. They were very supportive in our natural approach to birth, and they explained to us the options, the pros, the cons, the concerns with injectable vitamin K versus oral vitamin K, the heel prick test, all of those things. They really stepped through with us, and we conferred with our doctors here at TLC to see what would make most sense for us. And we had a beautiful birth at home. We welcomed our little August wonder into the world, and we did do the heel prick test where they check coagulation and the thyroid studies, and we did vitamin K supplementation, and had a very healthy baby. And just
orally or by injection?
We did that is a good question. If you do it orally, I remember you had to be diligent about it and give the baby the oral vitamin K consistently for every day or every week or something like that. And if you did the injection, it was sort of a one and done. I think we opted for the oral vitamin K just because that's a more natural route of administration versus getting vitamin K intramuscular.
Right, yeah, which is not natural.
Right, so that was our choice.
Okay.
So check out a midwifery is what it's called, where a nurse midwife could guide you through that. And they tend to already be very pro-mother, pro-birth, and as natural a means to birth as possible versus the system of birth that you'll find in a hospital.
That was South Coast?
South Coast Midwifery.
South Coast Midwifery.
Can't say enough good things about that. That was an amazing experience. Okay, next question. Are there any studies that may indicate a correlation between being nauseous and other pregnancy systems in first trimester to the mother's overall health and diet before getting pregnant?
No.
Prior to getting pregnant?
No, I think nausea of pregnancy is pretty much a common and universal thing in most women. I don't think there's any clear-cut statement that the health of the mother is, if superior, she'll not have the nausea. Right. Remember, unless your husband has your same blood type, this child growing in you has 50% DNA material that is foreign to you, and your body as a woman has to sort out what is safe and foreign and what not to attack, so to say. That's the basis of the Rogaine injection at time of birth. But again, what we found with nausea of pregnancy is protein. The lower the serum proteins, albumin, blood urea nitrogen, globulin levels, the more nausea. So I'm going back almost 40 years to all the babies we delivered at Cook County Hospital in Chicago. And what we would do in our clinic there, and we had mostly women who were poor at Cook County. It's a county hospital. And most of them were either Hispanic or Black, and by majority. and their income to eat a higher protein diet with healthy fats was more limited. So we would boil hard-boiled eggs all the time, and we would feed this to all the women coming, and that would pretty much quelch their nausea. So I strongly encourage all the pregnant women in our practice to push the issue of finding out your blood type. If you're blood type A, you could make an argument that they might have a little more nausea because they don't digest well. Therefore, they don't eat more complex foods as like proteins and fat as much. So I stress eat some protein for breakfast. Remember, we teach whatever you had for dinner, make enough of it so that you can literally have that ready available in the morning, especially if you're pregnant, and have a little more chicken in the morning, or a little more fish in the morning, or eggs in the morning, or ham or pork chop or beef or whatever you're going to eat. And that seems to quelch the nausea.
All right, great questions there. And I'll just mention, I'll do a little throw out for either Dr. Kaur or Dr. Mitchell, two of our physicians here who specialize a little bit more in mothers and infants. You've delivered many, many babies and worked in hospitals, but now your focus is more on the adult population.
Right.
I think that's right up there, Allie.
Right.
Next question is for people who are lactose intolerant or have milk allergies. Is there any milk alternative that is just as good and beneficial to one's health as raw milk?
Well, humans shouldn't have to drink milk. You should be able to get all your nutritional value from non-milk, not using milk, from your fish, your meat, your chicken, things like this, and some lentils. The question is cheeses, that is a milk source. Remember, we teach don't eat the same food day after day after day after day.
Right.
So I would say if you go for goat cheese, okay, or if you must consume a liquid form, goat milk.
Right.
And then I would only do it like every third or fourth day. I wouldn't use it every day. But I'm not in favor of drinking milk on a regular basis.
Right. If I'm making a protein shake at home, I usually use water just so I'm not adding, calories or sugars or anything like that. If I do a milk substitute, either in my coffee or my protein shake, I personally prefer organic coconut milk that is full fat and unsweetened and organic, right? Mm-hmm. So that's what I reach for. I'm getting all those beneficial fats in the coconut milk, and very low to no. I don't think there's hardly any carbohydrates in that. So that's what I use.
Well, those often those almond milk and coconut milk and rice milk and cashew milk, they're all often very high carb.
Right. That's why I go for the coconut one, because I want to say there's only like 1 gram, if 2.
But then again, I wouldn't use it every day.
No. Right. Exactly.
I would mix it up.
And I'll also mention we have the Perfect Aminos, which has been studied. That's a supplement. It's called Perfect Aminos, mm-hmm. and it has been studied on cancer cachexic patients who are wasting away. They cannot get enough or hold on to or digest enough calories.
Right.
And it's stopped and even reversed that cachexia so that they're putting on muscle mass.
Right. Yeah. So it was developed by Dr. Meineke. And he's, I think, won something like 20 triathlons for his age group. He's in his late 70s or early 80s. Right. Yeah.
Excellent source of amino acids, which are the building blocks of protein. And especially if you're an athlete or you exercise a lot, I supplement with that as well too. Next question is, how do you treat bronchiectasis? Bronchiectasis. Thank you.
Well, that's a spectrum of the lung, a viral lung pneumonia, chronic, smoker's cough, chronic reactive airway issues. Children get a bronchiolitis, often from allergies. So this is a reactive airway, quote unquote, /allergen/viral issue in the lungs. And how do you treat it? Well, you should be seen by a doctor and make sure this isn't serious, progressing on to some pneumonia and so forth. So you would see your physician. But if you have this very hyperactive allergies, I'm a B-type blood person, and again, this is Wednesdays. Every Wednesdays they're out there. Yeah, they're all my allergens are stirred up every Wednesday before these videos.
Mine too. Thanks, Mom.
Yeah, and so I can just feel the congestion come when I walk through here, and I must take natural antihistamines like DHIS and LRDHQ. Sometimes I will use my homeopathic drops to keep it, but I drink water copiously to help make it easy to expectorate the wet phlegm from the bronchiectasis.
I see you using the Argentin spray with washes and coats.
That's a broad spectrum antibacterial, viral, and antifungal. That's the silver hydrosol silver that I spray up my nose every morning before I go to bed, especially this season of the year. This is the blooming fall, the dust and the drying of the leaves time for me, so it's my hardest time. So it's important to have plenty of vitamin C because it's an immune stress with bronchiolitis, bronchiectasis. It's important to have your vitamin D level up. It's important to be well hydrated. It's important not to be on a high carb diet so your little capillaries aren't clogged up with all that gooey fruit, sugar, sticky carbs, so you get a nice, good circulation going. It's important to stay physically active, and not be sedentary where you get sedimentation of mucus material. It's important not to eat late at night. In other words, the same old things work for take extra vitamin D for 5 days. We have the high dose D50,000, one a day per day for 5 days. Start using your nasal spray. After you brush your teeth, you can take the liquid of the Argentin that you use up here. I will brush my teeth and then I'll take a sip out of the bottle. I'll swish, gargle, and then I'll swallow it. And then I take more enzymes. Enzymes help break up the mucolytic material so you can expectorate this better as an anti-inflammatory. I take my antihistamines because bronchiolitis is often associated with allergens and reactants and things like that. So and then we have the high dose vitamin C drips and so forth like that.
I was just about to mention, if you have access to a place that does vitamin IVs, those are wonderful.
Magnesium IV would be a nice bronchial relaxer. Yes.
Absolutely.
Yeah.
Right. And that high dose vitamin C is great on just deflaming and calming down the allergic reaction.
Which brings up, I wanted to bring up an article. This was from October 1st, just a few days ago, from the journal Cell. And this is called, by title, Robust T-Cell Immunity in Convalescent Individuals with Asymptomatic or Mild COVID-19. So this is a very interesting article. And the highlights are the research showed polyfunctional SARS-CoV-2 specific T cells, meaning these T cells, your immune memory cells, are polyfunctional. And they also occur in seronegative individuals. So if I have a test for COVID-19 and I'm seronegative, I'm negative for the antibodies. If they test my T cells, I may have a very good reaction, polyfunctional, for defense against this. And it's very likely because as a doctor over 40 years, we've seen quite a lot. And then a second point was convalescent phase SARS-CoV-2 specific T cells generate broad responses. And so they have great, kind of like the polyfunctional studies, but these T cells have broad protective functions in your immune system. And then also finally the acute phase, SARS-CoV-2 specific T cells display an activated cytotoxic phenotype. And so the good news here is if you go to the end of the article, I'll read, our collective data set shows that SARS-CoV-2 elicits broadly directed and functionally replete memory T-cell responses, suggesting that natural exposure or infection may prevent recurrent episodes of severe COVID-19. In other words, it's going to boost your immune system. And finally, they say antibody responses have also been shown to wane after infection with SARS-CoV-2. The antibody titer will go down after many weeks, suggesting that transient humoral antibody immunity is a general feature of coronavirus infection. However, the fact that memory B cells and memory T cells are generated in response to SARS-CoV-2 suggests that natural infection may elicit protection from severe COVID-19. In line with these observations, none of the convalescent individuals in this study, including those with previous mild disease, experienced further episodes of COVID-19.
So sum that up for us.
I think we can be confident in understanding we have a wonderful immune system.
Yes, we do.
And we have T cell memory cells, we have B cell memory cells who do a wide range of protection against viruses that we come into exposure. Just think of your newborn baby. Your baby's immune system is starting to respond to the world around him with immune memory cells. Well, we don't lose it when we get older, okay? It may diminish. That's why you want to be low carb, drink water, not eat late at night, stay active, take some vitamin D, take these other things.
Right.
But we have memory cells that give a broad spectrum of immune recognition should I come against COVID-19 as I practice medicine over and over, and I should be doing well. I should probably not have any repeat or any severe responses. So it's just reinforcing good news about good science on we have great immune systems, and I just want to say thank you, God.
Thanks for that information.
And the researchers, of course. This was the researcher author was Takuya Sekine, last name Sekine. A group of them, but that was the chief investigator, Sekine, Sekine et al. In Cell of October 1st, 2020.
Right, and this is fascinating because we've been hearing about herd immunity, but then there's also T cell immunity.
Yes,
that's
memory
potential
cells
as well too.
Yeah.
So great information. Well, we are just about out of time. We do this every Wednesday from 9:45 a.m. Pacific until 10:15. Sometimes we go a little over as we have today. I see questions here waiting from Robert, the car, Kay, Hope, and we will answer your questions. What we're going to end up doing is we will start with those questions next week. So be sure to join us next week and we'll get your questions answered here. Thank you so much for joining us today. If you haven't already, please subscribe to the channel. Like the video, tell your friends and family about this, let them know they can join us on Wednesday mornings and ask a doctor, usually Dr. Ellithorpe, any and all health questions they have. And a quick disclaimer, this information, of course, is for general education and is not to replace the specific relationship that you have with your primary physician. So if you have specific health-related concerns or want to take this information and put it into practice, do be sure to follow up with your own doctor. Thanks for joining us, folks. We look forward to seeing you next Wednesday at 9:45 a.m. Pacific. Thank you.